The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC. And one of the exciting new procedures that has entered cardiology is TAVI, a replacement percutaneously of aortic stenosis. And we have a fascinating paper in press that deals with the complications of TAVI, particularly the cerebral complications. And I have with me the senior author, first author of that paper, Dr. Josep Rodes-Cabau. And Josep is the director of the Cardiac Catheterization Laboratory at the Quebec Heart and Lung Institute. So, Josep, you studied the incidence of cerebral events by diffusion-weighted MRI in patients undergoing TAVI by either transfemoral or transapical approach. What did you find?
We found that the incidence of new cerebral ischemic lesions after the procedures was 68% and was very similar in both approaches. In the transfemoral approach, 66%, and in the transapical approach, 71%. This was the main, I would say, result.
Yeah, so this is a bit surprising. One would have speculated that avoiding crossing the aortic valve retrogradely and going through an ascending aorta that may have plaque would have reduced the amount of cerebral events, but apparently that was not the case.
That's exact, and this was in fact our hypothesis when we started this study, including 60 patients. But I think that this study provides novel insights regarding probably the mechanism of cerebral embolism associated with these procedures, and demonstrate that by avoiding the manipulation of these large catheters in the aortic arch, ascending aorta, and crossing retrogradely the native aortic valve was not associated with a decrease of cerebral embolism, meaning that probably other mechanisms like the valve stretching of the native aortic valve is probably one of the main mechanisms associated with cerebral embolism during these procedures.
Well, I have to tell you, in reading the article, it's a little bit frightening that 2/3 of the patients had new cerebral lesions and most of them multiple cerebral lesions. I mean, what's the consequences of this?
We evaluated we assessed the neurological condition of the patients before and after the procedures, as well as the cognitive status, and we didn't find any correlation between these lesions and a neurological or cognitive deterioration in these patients. In fact, only 2 of these 60 patients had clinically apparent stroke within the 24 hours following the procedure. There's some kind of discordance in between the number of ischemic cerebral lesions detected by MRI and the stroke rate, and this has also been reported in the previous studies.
So, given that you detected cerebral lesions, new cerebral lesions in the majority of patients, 2/3 and multiple lesions, but they weren't associated with neurologic deficits. So where do we go? What can we do to improve the TAVI procedure so we don't confront these side effects?
Yeah, this is a very important question, and I think that despite of the fact that there is a huge discordance in between the numbers of cerebral emboli detected by MRI and the clinical relevance of these cerebral emboli, we have still in our series and in most series, including partner, about 3% of the strokes following these procedures. In fact, in the partner trial was up to 6.7% within 30 days. half of them directly related to the procedure within the first 24 hours. And this stroke rate, in fact, is one of the highest that we have ever had in transcatheter cardiac procedures, much higher than the stroke rate that we have during PCI procedures, or even higher than the stroke rate associated with left atrial appendix closure. And I think that in the future we will see new embolic protection devices coming up and being tested during these procedures, trying to reduce the stroke rate. And probably the cerebral emboli, as evaluated by MRI, can be an interesting surrogate marker than we can evaluate in terms of when we evaluate the efficacy of these embolic protection devices.
Well, there's no question that being able to replace the aortic valve percutaneously is a godsend for patients at high risk for surgery, but obviously it's not without complications, an important one being cerebral emboli. We'll have to follow this story closely. Thanks very much for being with us. For Inside JACC, I'm Tony DeMaria.